Hi, my name is Adriana Rosado, and today I'll be showing how to insert a male Foley catheter. Okay, so first I'll begin to make sure that there's a medical order for it. I will also see if there's any restrictions when it comes to position or physical movement that the patient can do, so that way I know what position I need to put them in and if they can help with that. Next, I will gather up my supplies. Once I've done that, I will enter into the patient's room. I will identify the patient from their wristband and also introduce myself. After I do that, I will close the curtains and the door. I will also explain to the patient what I will be doing. I will explain that it is a comfortable procedure, but it is in order to relieve them, and it's good. And if their families are, I will also do that. If you have any questions, then I'll explain. At this time, I will also ask if they have any allergies related to latex and iodine. Okay, so once I do all that, I'm going to lift the bed to a comfortable position, which is around elbow height. Okay, next I will lower down the side wheel and put on my gloves. Next, I will expose the patient just from the waist down. And then I would ensure that the patient has a waterproof pad so that I can take them back. Then I will gather my supplies, so my bath towel and my soap water, or anything else I would use to clean them. Okay, so I'm going to start with this towel. I'm going to grab it. I'm going to do circular motions, making sure to change it every time. And I will also clean down the shaft. Okay, now that I'm done with that, I'll put it away, and then I would grab a dry one and I would pat it dry. Okay, once I'm done with that, I will put this away and I will remove my gloves. I'll put those in the trash can. Next, I will begin to set up my sterile field. I'm going to put this away. Thank you. I'm going to be using this as my trash can, so I'll put that at the feet of my patient. I'm going to keep this in case I need to refer back to it. Now I'm going to open it, making sure to only touch the corners. And I'm going to open up my gloves. Making sure to only touch the outsides.
How long did I do the
Okay, so now that I have that, I will begin to set up my area. Okay, so first we'll put this. I'm going to be very careful as I'm touching it, making sure that the shiny side is down, also making sure not to touch my patient. Okay, I will not be using this, so I'll put that aside. Next, I will make sure to only grab the tips, making sure the shiny side is facing downward, making sure not to touch my patient. that they were allergic to iodine. So I will not be using that. Okay, so now I'm going to open this, pour it on the cotton balls, as well as open my lubricant and pour it here. And just, we don't need that. So now I can transfer onto the bed. Making sure to carefully not touch my patient. Keeping my hands sterile. Okay, now what I'm going to do is I'm going to take out my tube. At this point, I would take off the wrapping that would be on it. This one doesn't have a wrapping. And then I would attach the syringe after I remove the cap. I would do this. I could also inflate the balloon in order to ensure that it works, but I have already done that. And I will not be doing that today. So next I'm going to insert it into the tube, the tube into the lubricant as I wash the patient. So at this point, I'm going to establish that this is my clean hand and this will be my sterile hand, understanding that once I touch the penis, I will not be able to remove it, and if I do, I'll have to start cleaning process over again. So we are going to clean it down and expand it.
I'll be professional. Okay, at least you didn't have to you might have to.
Okay, so I'm ensuring that it's clean. I'm gonna also dispose of that. Okay, so now that my thing is lubricated and everything, I am going to insert it. I will inform the patient that to take a deep breath, that it is a little painful, so now we'll begin to insert it.
Hi, my name is Laura Pankowski, and I'm going to do an insertion for a female Foley and then the removal of the female. So the first thing I'm going to do is I'm going to look over my patient's record, see that they do have an order for the Foley, see if they have any physical limitations. I'm going to gather all my equipment.
Okay, so now that it is in, I am going to fill it. I'm going to. Usually we would do it to verification, but it doesn't reach for this mannequin. Okay, so once I do that, I'm going to remove the syringe. Throw it away. Okay, now I am going to tug until I feel resistance. Okay, after that, I will attach it, making sure that there's some slack and making sure that the patient can move. I would either do it with a sticker or a band that goes around. Next, I will attach it to the bottom of the bed. Next, I will remove all of the garbage, making sure not to touch the patient.
Expose the area that I'm working with, so I'm going to expose this.
Okay, next I would take off my gloves.
Up like a bath towel or a blanket, and then retract the foreskin. I'm going to explain the procedure to them. Ask if they have any allergies.
Okay, so at this point, I would then
If they say no, then I
put the patient back in a comfortable position.
if they do, then I have to use hydrogen. The next thing we're going to do is we're going to put on clean gloves.
And put up the side rail.
And when I do that,
And then also I would put my gloves back on if I were going to take a specimen. Okay, but I'm not going to, so I'm going to make sure that the patient is nice and covered before I leave. And that's it. Now I will demonstrate how I will take out the Foley. So I will first make sure I would do all the repeated steps. I would take off my gloves and make sure that I clean my hands. So then I would enter into the room. I would make sure that there's a medical record to take out the Foley. After I do that, I will come into the patient's room. I will lift up the bed to like around elbow height. Okay, and this side rail. Then I put my gloves on.
mentioned was cooperative. And then we're going to take the water and wash it in. We're going to start the physio. And then to make sure that
So then after I explain the patient what I will be doing, I will expose them again.
so we're going to go from the outside down.
Okay. I'm also going to take out this before I drain it. I'm gonna make sure I'm gonna drain it. I'm gonna calculate the output that's in here. And once I do that, then I will again put a waterproof pad, making sure that the patient, doesn't leak out or anything on the bed. And then I will attach my syringe to empty out the Foley.
I'm just going to set this down. I would have it.
It fills itself. You don't want to push pull, and hurt the patient.
Now we're going to open the catheter itself. So I want to check see what size it is. In the event that I have
So you're just going to let it do it naturally.
need to get a smaller catheter.
Okay.
This one should be just fine.
For the purposes of time, I'm just gonna. Okay. So once that's filled up, you're gonna tell the patient to take a deep breath, and you're gonna begin to coil it and pull it out. Then you're going to wrap it up so that nothing is squirting out, and you will dispose of it in the trash can. Okay. After you dispose of it in the trash can, I would remove my gloves. Then I will cover up my patient. I will lower them. And then I'll put up their side rail and let them know if they have any questions they can ask. And then I wash my hands and remove my PPE.